So I've subtitled this Teeth in the Door of Healthcare. My mother had all of her teeth when she died, except for a gold bridge, and I know not the circumstances from which that came. But I went to the dentist every 6 months for as long as I remember. And I think that's where my interest in oral health came from. We're in the middle of an epidemic as significant as the current opioid epidemic. Early childhood caries with progression to cavitation, cavities in midlife, and absent teeth in seniors are increasing in the US today and have an enormous impact on achievement and productivity in our society. Many seniors consider it normal to have teeth replaced or totally absent by age 65. But these diseases, as we all know, are largely preventable. To provide value-based health care in the 21st century, we must look out of our silos to new models of care. In addition to care through dental facilities, there's an equally important opportunity to teach oral health preventive strategies in both medical and behavioral settings. Children visit medical offices at least 15 times in the first 2 years of life and annually or more thereafter. Most adults visit annually or more often than that. Physicians and dentists and behavioral health specialists must collaborate to provide health homes, if value-based care is to become a reality. I'm excited to tell you about this concept because it can be adapted and implemented now in all health care facilities and emergency rooms with minimal or no need for accommodation or system changes. At All About Children Pediatric Partners in Reading, we've begun to increase oral health literacy, increase patient satisfaction and practice income, and do value-based oral health care. And we have successfully accomplished getting dental appointments kept, and we've decreased our costs through the presentation of proven oral health strategies to our families. In August of 2015, Amy Requa, whom you all saw earlier, sent Manelli Muniz, an EFTA, Extended Function Dental Assistant, to my office to pilot oral health education in our waiting room. I was thrilled. After 30 minutes in the waiting room, Manelli came to me and said, "This isn't working. Parents are on their cell phones texting, and I'm babysitting the children, not educating their parents, and the kids are sort of in and out." So we decided to try teaching the families, the whole family, in the examining room as they were waiting for their pediatrician or nurse practitioner. It worked, but I had no one to continue at All About Children. In November, a call came from Donna Schoenecker, who is here. Donna, raise your hand. A dental navigator and a PhD HP with AmeriHealth Caritas. She came once a week for 8 hours in our office, spent a half day with each of our clinicians, and talked with the office support staff informally. She saw patients in the exam room with their families while they were waiting for the clinician, and then presented her findings to the families, or to the clinician. She recorded brushing, flossing, water intake source, and the last dental appointment in the dentist's name. She inquired about sources of dental care for the family and redirected patients who were unhappy with the poor quality of dental care to their choice of dentists from our list of dentists who accept their insurance. If not only already in existence, appointments were made for the patients before they left the office. This strategy is supported by data from Dr. Hugh Silk, whom some of you know, to achieve appointment rates as high as 90%, versus 40% if given a list and 10% if told to call the insurance company. Donna's still involved with us. In April, we were joined by my personal dental hygienist, Mary Grace Rue, when her dentist retired. She has a wealth of experience. She provided oral health education in county schools along with Dr. Laubach and works monthly at the Children's Free Dental Clinic at St. Joseph Hospital. She frequently participates in continuing education. We have her 12 hours a week. She's worked successfully with some of our most resistant negative families. She's convinced them to drink fluoridated tap water and to brush with fluoride toothpaste, along with diet instruction to visit their dentist and not to be afraid to do so. She offers them oral health-based books on a schedule that we worked out as an addition to our Reach Out and Read program. We've given out more than 500,000 books since 1996 to our patients. Thank you. So our hygienists enter the exam room during or after the patient prep process. They assess risk. They educate patients, parents, and children. They connect the family to a participating dentist and schedule appointments before the family leaves the office. They can apply fluoride varnish. These services are recorded as a procedure in our electronic health record. What happened? During the first 6 months of the project, the cost for the part-time hygienist was $13,000. The extra revenue generated from the project was over $15,000, which more than covered their salary. They provided oral health education to 7 physicians and 7 nurse practitioners, and they educated more than 1,000 families during that 6-month period. We were able to tap into the dental HEDIS data for our AmeriHealth Caritas patients, and as you can see there, we increased our dental visits with the dental providers by 7%. Our baseline last year was 60 or 61%, just for reference, so we're higher than the norm to begin with, but we increased another 7% in that 6 months. And our clinicians applied fluoride varnish 30% more than they had in the 6 months of the previous year, the same period. Staff and parents have been totally enthusiastic. They're just thrilled. So future revenue for the office is anticipated from our dental HEDIS bonus and the billing of the risk counseling codes 96152 and 96154, along with the fluoride varnish. We continue our data collection at All About Children and hope to spread this model to additional offices and perhaps even to the emergency rooms. It can be easily replicated across the state in healthcare offices of all kinds and in emergency rooms. The exceptionally positive and enthusiastic response of both families and staff has been rewarding. There we go. And my thanks to Amy and Manelli and Donna and Mary Grace and all my PCOH, my POCHI colleagues and my staff.